Hello, everyone, and welcome to today's media dialogue titled Hand Hygiene Can Save Your Life, commemorating World Hand Hygiene Day in Africa. I'm Wayne Sharp, Health Media Specialist with the Internews Rooted in Trust project, and Internews is one member of the group hosting this dialogue, the Media Task Force of the Eastern and Southern Africa Interagency Working Group for Risk Communication and Community Engagement. My co-moderator is Tola Nyata, an Internews pandemic media mentor based in Zambia. Hand hygiene saves millions of lives every year when performed at the right moments during healthcare delivery. It also offers exceptional return on investment, protecting health workers, caregivers, and those who seek care. But despite the importance of hand hygiene, a global assessment found that the Eastern and Southern African region ranks lowest, with around 47% of the population lacking access to at least basic drinking water services. Health workers in this region have been greatly affected by emerging and re-emerging infections in recent months and years. The WHO Regional Office for Africa is commemorating World Hand Hygiene Day on May 5th, tomorrow, with the slogan, "Together we can accelerate action to prevent infections and antimicrobial resistance in healthcare." WHO seeks to build a culture of safety and quality in which hand hygiene improvement is given high priority. Along this theme, today's media dialogue is devoted to a discussion of the importance of hand hygiene, and we will hear from several experts from a variety of backgrounds to discuss the challenges they face in improving infection prevention and control and water, sanitation, and hygiene. That's IPC and WASH for short. Our first speaker is Dr. Landry Kebego. Dr. Kebego is a medical doctor and specialist in medical virology, and he leads the WHO's Africa Region Infection Prevention and Control team under the cluster of emergency preparedness and response. As part of his daily work, he's guiding member states on the process of establishing or strengthening their IPC programs at national and healthcare facility levels by developing national and facility action plans. Dr. Kebego, welcome back to the media dialogue.
Thank you so much, Wen, for this introduction. It's a pleasure to participate today on this media dialogue, where we are going to discuss a little bit about the importance of hand hygiene. Each year since 2009, the WHO organize a campaign of hand hygiene worldwide. And this year campaign, the theme of this year campaign is Accelerate Action Together. Save lives, clean your hand. So hand hygiene save millions of lives. I hope that we all know that even if it's performed at the right moment during healthcare delivery. It's also a smart investment that offers exceptional return for each dollar invested. If you invest in hand hygiene in healthcare facilities, we'll have less healthcare associated infections, and the costs of healthcare will be less. So clean care is a sign of respect to those who seek care, and it protects health and other workers who provide that care. Now it's critical time when countries across the world need to accelerate implementation of lessons from the COVID-19 pandemic and increase investments to close the gaps in infection prevention and control. Together, we can galvanize action on preventing infections and antimicrobial resistance in healthcare. Strong and engaged communities of health workers, policymakers, and civil society organizations is a major requirement to achieve this goal together. For World Hand Hygiene Day 2023, we put the civil societies in focus, driven by their passions, values, and strong social justice agendas, and often in close proximity to the communities they serve. Civil society organizations can spearhead and accelerate change at local, national, and international levels. WHO is therefore calling on all civil society organizations and other partners organizations like the members of the global IPC network to engage with the campaign to accelerate progress at achieving effective hand hygiene at point of care. This year's theme is together we can accelerate action to prevent infections and antimicrobial resistance in healthcare and build a culture of safety and quality in which hand hygiene improvements is given higher priority. This year's slogan is accelerate action together, save lives, clean your hand. And the campaign objectives are first to strengthen and empower communities of actors in healthcare to accelerate action to improve hand hygiene and infection prevention and control at points of care, to foster collaboration and working together of people and organizations toward the common goal of minimizing the risk of infections and development of antimicrobial resistance in healthcare. So the call of action for IPC practitioners is to lead the way for clean hands. Hand hygiene can prevent infections. It can help to combat antimicrobial resistance and saves millions of lives every year when performed at the right time in healthcare. So, save lives by promoting the 5 moments for hand hygiene and supporting your colleagues to achieve excellence in hand hygiene practices. Let your colleagues know about the new WHO game, My 5 Moments for Hand Hygiene. The call of action for the health and care workers is to love the 5 moments. Cleaning hands at the right time, every time, means safe, quality healthcare for all. Only together we can keep patients safe throughout the healthcare journey. Practice your 5 moments every time. And to policymakers, invest for health and dignity. Hand hygiene is not a luxury. It is smart investment that saves lives and money. Improve IPC training and education, strengthen IPC programs and infrastructures at national and facility level. To people who access care, join the movement. Infections acquired in healthcare facilities are avoidable. Clean hands protects you and your healthcare team. Keep learning from the COVID-19 pandemic in mind. Protect yourself and others for infection by cleaning your hands. Be interested in your own care. Talk to health and care workers about the importance of clean hands. Being part of WHO hand hygiene campaign and movements, it's really important for all of us so that we can achieve our common goal of decreasing the rates of healthcare-associated infections in healthcare facilities by improving the compliance to hand hygiene. Thank you, and over to you, Wayne.
Thank you very much, Dr. Cabego, for that wonderful overview. There are some questions here, excuse me, but I think we'll have a couple of speakers first, and then I will go to speakers. So next, I would like to welcome Dr. Yewande Alimi. Dr. Alimi is the Antimicrobial Resistance Program Coordinator at the Africa Centers for Disease Control and Prevention. And she is the co-lead for the Africa Union Task Force on Antimicrobial Resistance. Today, she will talk to us about the issues of political commitment and financial support that are needed in promoting hand hygiene practices. Dr. Alimi, welcome to the Media Dialogue.
Thank you very much, and good afternoon, good morning, good evening, depending on where you're connecting from. We're quite pleased to have you, and it's a pleasure to join our colleagues at WHO to celebrate and commemorate this day. As my colleague has rightly mentioned, it is very clear that hand hygiene as well as IPC practices can greatly improve how we address infectious diseases as well as AMR. He has really highlighted the role of healthcare workers, the community, as well as other relevant stakeholders. But it's quite critical that we have that political momentum and financing to really create that enabling environment. Africa's population has exponentially increased over the past couple of years. However, investment in health and access to clean water has not increased. 62% of our population has no access to basic water services. When we think about hygiene as well as basic sanitation service, 60 to 65% also lack this. We know the importance of WASH as well as IPC in controlling diseases which you may be familiar with, such as cholera, currently ongoing in southern and eastern parts of Africa. We try to highlight the disparity in terms of access to clean water or hand hygiene services in healthcare facilities as well as schools. And you can see from the numbers, it's rather appalling. And it's important for us to really take some real strong political moves and domestic financing to increase this. As my colleague has said, access to hand hygiene remains a luxury in many parts of the African continent. So what, as the African Union, we recognize that it's quite important for us to really push that political advocacy and political commitment required. We highlight the Assembly Declaration 33, which is the common position on antimicrobial resistance. In February 2020, the heads of states and governments of the African Union made a political declaration to increase the proportion of healthcare facilities implementing IPC programs, as well as antimicrobial stewardship programs. But most importantly and relevant to this discussion is the political move to increase access to clean water, sanitation, and hygiene in healthcare facilities and beyond healthcare facilities, thinking about schools, households, and community settings. But at what cost? We recognize that money does make the world go round. And more than ever, partners such as WHO, Africa CDC, UNICEF are making a strong economic case for IPC. It's important for national government to invest in cost-effective measures such as WASH and IPC, which can really drive behavior change and improve hand hygiene practices across healthcare workers and non-healthcare settings. It's important for us to make a case and also document and estimate the cost of inaction. At what cost when governments don't invest in access to clean water? We need to be able to document this as technical experts, and most importantly, the media to help us narrate the story right. It's important to leverage on continental initiatives, such as the Africa Continental Free Trade Agreement, to see how we can really address issues of access to PPE, as well as local manufacturing across the continent. Nevertheless, I highlight the most important thing around engagement in communities is civil society organizations. As a continent, we have rich experience in utilizing the expertise of civil society groups. Think about HIV, think about TB, think about malaria. Those were strong voices to really hold our national government and policy makers accountable. More than ever, I think it's time for us to really come together to work very closely with our civil society groups as they continue to work across the continent to really make a strong case for improving IPC and hand hygiene practices across the continent. Lastly, it's important for us to address this in a very holistic manner. And this is what we call the new public health order for Africa. Is to ensure that as Africa, we have strengthened national public health institutes. We strengthen and work together through respectful, action-oriented partnerships. We strongly use our political mandates to increase domestic financing and create that financial investment for health. We invest in our public health workforce and leadership programs and really create a rich environment for local manufacturing of things like alcohol-based hand drops, as well as soap, which many countries don't even produce locally. Lastly, I think we all need to work together to ensure that we have that strong political commitment as well as financial investment to really strengthen IPC as well as WASH services across the continent. We are pleased to join our counterparts in WHO to commemorate this year's World Hand Hygiene Day. We hope that our engagement with the media would really champion and direct this message to the right policymakers, the right healthcare workers, and most importantly, the civil society groups who can really work with us to engage communities to improve hand hygiene practices across the continent. Thank you very much.
Thank you so much, Dr. Alimi. Before we go to our next speaker, I would like to go to our first question from a participant in today's dialogue. This question is from Colette, and I think this could be answered by both Dr. Kebego or Dr. Alima. The question is, how can we ensure that health workers and the community take ownership of the practice of hand hygiene? Would either of you or both of you like to address that question?
Can you come again, please?
Yes, gladly. How can we ensure that health workers and the community take ownership of the practice of hand hygiene?
Okay. So there is the multimodal strategy for the implementation of the IPC measures that WHO has developed. And that strategy has been developed for hand hygiene. So the idea is to have a combination of several strategies that put together can allow a better compliance on hand hygiene. And especially in healthcare facilities, you need to have the combination of the following elements. The first element is you need to have policies around hand hygiene. You need to make sure that you have the guidelines. The second thing, you need to make sure that you provide necessary training to health workers on the guidelines for hand hygiene. The third thing, you need to make sure after providing the education, necessary training, you need to make sure that you monitor the implementation. You make sure that there are some tools that WHO has developed, like the hand hygiene self-assessment tool. And you need to make sure that each health worker effectively perform hand hygiene when needed. And this will help to see the progress towards hand hygiene. There are also in healthcare facilities, you can put in place some communication tools, mechanisms, flyers at the point of care, but as well as you need to reinforce the culture for hand hygiene to a more sustainable, but ensuring that the managers of the facility, they are involved in hand hygiene activities. For example, when you organize activities for the 5th of May in your healthcare facility, you make sure that the director of the facility provide supports to that activities so that all the health workers can get involved as well for that activity. So basically, when you combine these different strategies, usually it is proven to provide a better outcome. Thank you.
Thank you, Dr. Kibego. I will, Dr. Alimi, would you like to add to that?
Thank you very much, Wayne, and fantastic insights from Landry. I think just at a community level, to remind, and this is quite important message for the community, is that in the past, think about COVID, we have been able to document improved and hygiene practices as a result of this, and particularly because we had that shared responsibility. So as a community and as the general public, it's important to see hand hygiene as a shared responsibility. Me keeping my hands clean means that I'm not only protecting myself, I'm protecting my daughter, I'm protecting my son, I'm protecting my husband, I'm protecting my grandparents, I'm protecting us as a community. So see this as a shared responsibility. You protect yourself, you protect your district, you protect your province, you protect your country, you protect your region, and you protect us as a continent and ultimately the globe. So really, for the community, for the general public, is that sense of a shared responsibility. Over to you.
Thank you so much. That's wonderful. We have more questions, but I'd like to introduce our next speaker. Pierre Fourcassi is a water, sanitation, and hygiene humanitarian specialist with the UNICEF Regional Office for Eastern and Southern Africa. Pierre has 28 years work experience as a WASH program manager and technical advisor in Africa, Southeast Asia, Central America, the Middle East and North Africa, and Europe, including 25 years in Watsan and hygiene sector with NGOs. Pierre's here to talk to us about the importance of water, sanitation, and hygiene in health settings for dignity and quality of care, and the current gaps in WASH that we're seeing, and domestic and international opportunities to promote it. Pierre, welcome to the Media Dialogue.
Thank you very much. And can you hear me well?
Yes, hear you loud and clear.
Yes, sorry, I have to take from my phone. So I will be brief, and because it's a media dialogue and and we'd like to hear from the media colleagues the question they have. With regards to the question related to practices, I think what's important is also to make the staff, all staff working in the healthcare facilities, all patients and co-patients aware of the risks. And this is, and there are, as Landry mentioned, the strategies. One of the strategy is really the buddy strategy, having healthcare workers working in buddies and taking care of each other, looking at each other and making sure that they wash hands at the key 5 moments. And I'm really excited to hear about this game and to play this game about the five key moments mentioned by my colleague from WHO. So I want to start with the data. Data is really important for the media, and I really encourage you to visit the UNICEF and WHO websites on data. It's very easy. It's called washdata.org, washdata.org, and you can have access to all data from the household level, school level, and healthcare level, and you can make your own graphs by region, by countries, etc., by wealth, etc. So it's very a very good website for the media. I want also to say that in addition to the Health Hygiene Day for healthcare facilities, the other important day is the Global Hand Washing with Soap Day, celebrated on the 15th of October since 2008. This is for communities and school. But back to the healthcare settings, and indeed, as I talk on behalf of UNICEF, the young children and the newborn children are the most at-risk people or vulnerable group, as they are very vulnerable to preventable infections, in particular those due to the lack of hygiene in healthcare settings by all healthcare workers, patients, and co-patients. And another message is about the cost. I mean, I don't think it has been mentioned, but there are studies showed that hand hygiene with soap in healthcare facilities is cheap compared to the cost of treating the infections or the days lost due to diseases. $1 US or any currency invested in hand hygiene as a result it results in 15 USD or 15 times in gains due to the less infections and to treat and less working days lost. I don't want to talk more about hand hygiene in healthcare facilities. I just want to mention as well that preventable diseases, any kind of infections, diarrheal diseases, acute respiratory diseases are also transmitted in schools. And it's important as well to invest in hand hygiene in schools, as in sub-Saharan Africa, about half of children do not have access to basic water in school, and about 2/3 of children do not have access to a hand hygiene station. That means a continuous service of water and soap at school. 2/3 of children do not have access to a hand hygiene at school. And we know that UNICEF and the government, the MOH, and the Ministry of Education work actively in schools in investing in, of course, in services, but also in approaches that work for children to wash hands through, for example, supervised hand washing with soap, led by the school health committee or the school health clubs. Also, games installing in schools, but also in healthcare facility, low cost and low tech hand washing stations, and also budgeting for soap. So it's very important to consider as well in transmission of diseases in other settings like schools. Voilà, so I will stop here. I think it's we like now to hear from the media if they have any questions related to building the culture of safety and quality of care in healthcare settings, and in particular in maternities, but also in other settings with children like schools. Thank you very much.
Thanks, Pierre. Yeah, we do have more questions, and I have a question I would like to pose perhaps to the three speakers we've heard from so far. It's my understanding that with the outbreak of COVID-19, there was a very concerted effort to increase the availability of hand hygiene in the region, and that gains were made during that time. Now, have those gains been realized? Are they continuous now, or are we seeing some backsliding on hand hygiene since the COVID-19 pandemic has peaked and now is decreasing? Would anybody care to address that question?
Maybe I can comment. I don't have proper figures, but there is a general comment that I'm going to provide it, especially around the implementation of infection prevention and control in our region. So usually, not only for COVID-19, but we saw in other outbreaks like Ebola. During outbreaks, generally, we have strong commitments to implement IPC activities to improve hand hygiene compliance and all the other standard precautions. Unfortunately, due to the lack of strong IPC programs at each level of the health system, from national to facility level, there is a tendency after an outbreak pandemic in our region to see all the gain obtained during the pandemic, during the outbreak regarding to infection prevention and control. They usually vanished. And this is due to the fact that in many of our countries, IPC is not institutionalized. All these activities usually are being in place only to stop the chain of transmission of a given infectious disease outbreak. And then after that, everything is disappeared. But I think that in few days, the global strategy for infection prevention and control will be submitted to the 76th World Health Assembly. I think this will be a major change in the way IPC is being perceived by the member states and its place in the health system. I think from that, we will continue supporting the member states, and we think that we will continue improving all the measures, IPC measures that we are implementing in the member states. Thank you, and over to you.
Yes, I can.
Yes, please go ahead, Pierre.
Yes, thank you, Andrea. And just to, perhaps I'm not so, I don't have data to share, and then I have just a few information related to cholera, but I don't think all gains have vanished. Especially the practices when during COVID, people have practiced, and then if there is, of course, the supplies, that means we talk about water, soap, or the solutions for hand disinfection. If it's available, if the habit has been, if the healthcare workers have practice, and it's possible that many of them have, they continue to practice. Now, regarding the other people, the patients, and when they go back to home, what we have is, due to the cholera outbreaks in about 10 or 11 countries in the region, colleagues from the risk communication and community engagement have conducted some operational surveys or quick studies, and they found out that the knowledge is there. I mean, especially among women and children, of hand washing. The problem is this is associated with this increase of prices, in particular, even the price of the water, the soap, etc. So families, especially among the poorest segment of the population, they do not buy soap, or if they buy soap, it's not for hand washing, it's for other purpose, for the body washing, or for clothing, washing the clothes. So that's important now and what we're trying to do with UNICEF is to advocate with the governments for waiving the taxes on essential and life-saving items like soap. And I think we will continue. It's really important to make soap accessible, affordable to the poorest people, for them to adopt these practices. Over.
Thank you very much. Just a quick note, we've had a request from a few of our participants today. They would like to know how to find the 5 Moments game. Is there a link that we could share during this webinar so that people can get access to that game? I guess that's a question for Landry. If you have a link, and we could type it in the webinar chat, and that would be helpful for people. I'd like to move on just for time to our 4th and final speaker, and then we will open the floor to more questions. Dr. Mwenge Waituro is Policy and Advocacy Advisor for Africa for Voluntary Service Overseas, VSO, in Kenya. He is a champion of volunteerism for ensuring the realization of a leave no one behind philosophy. He is here to describe the CSO sector's work in promoting hand hygiene. Dr. Waituro, welcome to the Media Dialogue.
Thank you very much, and we are very happy as VSO to be able to join and celebrate this day with all of us here. And thank you to the presenters who have been there, who have presented before me. So I'll build on that, and I'll briefly talk about the role of civil society or non-state actors in hand hygiene, WASH and IPC in general. And I'll use the case study of VSO. VSO is an organization that works with volunteers to create lasting change. And our interest in this particular piece of work is that volunteers at the community level are creating space for those most affected by poverty and exclusion to plan, implement, advocate for, and measure changes in their own lives and communities. And within this framework, we have partnered with UNICEF, WHO, and others under the WHO-led technical working group on IPC since the time of COVID to promote infection prevention and working on areas of hand hygiene and others. So I'll use that as an example to just show what we have done during COVID and also after COVID during the outbreak within the context of cholera outbreak. Again, we have 3 key interests at the community level. At most civil society organizations, their engagement in hand hygiene will reflect in one or the other these 3. The first is that we want active citizens. We want people, as particularly those who are vulnerable and marginalized, to be able to come together organize themselves and take actions as networks or as groups in their own community and to do self-advocacy. And we want those groups to be linked with more powerful actors in their community and beyond, because that builds power for them and they're able to bring change where they need it. We also want governments, or we support governments and other actors with capacity to deliver hand hygiene and other services in a socially accountable manner, in an inclusive manner, and also to build the resilience of the system. And number three, we work towards bringing policy and structural changes, and therefore we work on legal frameworks and guidelines. So the tool that we worked on together with the other partners in the technical, other agencies in the technical working group, it takes three approach. Number one is to do health promotion. So this means when you go to a community, you select the particular area that you want to focus on. After selecting the area, you also select the settings. This could be, in the case of the context of cholera, we are focusing on food settings. And when you go to a food setting, the volunteer, a trained volunteer for that matter, working with the community health workers and community health volunteers, and this could also be just community members, informal groups and others who have organized themselves. The first thing they'll do is to do health promotion. So this health promotion will include, for example, providing a report on the status of cholera or COVID during the time of COVID. What is cholera, how it is passed from one person to another, and the prevention measures, the symptoms and the like. Once you have done the health promotion at that setting with the individual at that level, you then use the community tracker tool or the scorecard to assess the gaps. After assessing the gaps at that level, you then come up with what adjustments are needed. And those adjustments could be at the individual level, because you are doing it at the individual level with that person. And that is part of agency building, because people can take action at their own level. You also look at those actions that are needed at the community level, and then you look at those system-related changes that are needed. And in the process, you also create demand. You create demand for the hand hygiene services. The tool that we use will look at several areas. It has several variables. It will look at, for example, the hand washing stations in communities, the facilities, whether they are there, whether they are adequate, whether they are safe. It will go then and assess in terms of the gaps. Another variable that you look at whether, when those facilities are there, are people using those facilities? What is the practice, the hand washing practice by the people? We'll also go then and look at the same tool. We'll look at through a conversation with the people in their communities. We'll look at the socioeconomic and socio-cultural activities. And then we'll also look at perceptions, because the facilities could be there, but people are not using them. So we want to explain this. Is this as a result of the perceptions, the attitudes that people have? Are there communication programs that have been are being carried out? And we also look at the IPC community practice or programs. By IPC community programs and WASH, of course, the programs that are in community, we'll be looking at, number one, how have communities organized themselves to protect their water sources? If they have not organized themselves, what are the government programs? Do we have extension workers, health extension workers, public health officers who are enforcing the public health regulations to make sure that people are safe and they can access safe and drinking water? This tool brings results at, as I said earlier, at 3 levels. First, at the household level or at the individual level. And what we have seen is that because what is measured gets done, you find that when people score themselves on the scale of 1 to 3 to show their risk level, when they realize their risk and exposure level, they tend to make adjustments, and they can see from the tool the specific gap areas where they need to make adjustments. But we also bring the communities together in what we call the interface meetings. And in the interface meetings, we do the aggregate so that we can see what is the risk level within a given community. And an example is, let me give an example of Nairobi, where we did not in the informal settlements, but more or less the lower income, the resource poor settings in the Eastrats. And what came out, what the communities realized, because it's the communities, you put this tool in the hearts of the communities themselves. What they realized is that, number one, they scored very well on the hand washing stations facilities, and they also scored very well on the proportion of people who are practicing hand washing. However, when they looked at the IPC community program, they found that the water they are using could be contaminated, because they found there are people who open the sewer at night and release it in the open. And therefore you're doing hand washing, but in the absence of a strong IPC program, you are at risk. And therefore they identified an action of enforcing the use of the sewer system to make sure that landlords and people who have buildings do not open and release open sewer into the system at night, because that is happening a lot in their community. But they also found that even where they found that the IPC, the hand washing and the proportion of people doing hand washing was high, there was a segment of people called the food feeders. In Nairobi, they call them the motula and the smokies. They sell the intestines of the animals, and they do it in the streets. For those, people did not, one, perceive themselves to be at high risk, and therefore they tended to, just as they walk on the road, pick a sausage or a motula and chew it as they walk. And again, those vendors did not have facilities for hand washing, and even the way they were handling the money was also wanting. And therefore the community decided to bring this one up, and we are in that phase of the action where the community now is bringing this up with the leadership to say this is a weak area, it's an exposure area. We need, and because we also need to protect these small businesses, we don't want them to shut down. We need concerted effort, collective effort to improve hand hygiene for them in order to facilitate them to make a living, but within safe limits. Thank you very much. I hope that gives you an overall picture of what CSOs are doing in promote hand hygiene and hand washing, both in community and also in facilities. Thank you.
Thank you very much, Dr. Waturu. Excellent presentation. I'm going to combine a couple of our participant questions and statements because they're on the same theme. And this question that I will end up asking will be for all of our 4 speakers to answer if you care to. We have Henry Owino, who is a freelance science journalist in Kenya, who writes that much emphasis needs to be made on the use of soap and running water. Otherwise, just washing hands with water is not enough. Imagine 20 pupils washing their hands in stagnant water in a basin to save water. And Nabawanuka Doreen asks this question: hand hygiene and water supply are brothers and sisters, but how can we solve the issue of water supply in areas without water? We still need water to wash our hands at the point of care. yes, that's a very basic dilemma. If there is no water, how do you promote hand hygiene? Is that a question that any of our four speakers would like to tackle?
Yeah, sure. I'm happy to take a stab at it, given the fact that this really requires a strong political commitment. You must understand that no matter how much knowledge that the healthcare workers have, or the patients have, or the community has, if there's no access, it's impossible to practice. And this is where our national leaders, our policymakers, the ministries of health, the national governments really have a role to play. It's time for us to invest in health and equity. In 2023, it's quite sad that more than 50% of the continent lacks access to clean water, running water. So this is the part where we really require our civil society groups, our media, our journalists to really help us push that messaging. It's really time for national governments to make those domestic investments, invest in access to water, invest in infrastructure that can create access to clean water for your population. This should be part of the political mandate. This should be part of any national government's priority to ensure that we have the average person, urban community, rural community have access to clean water supply. So really, this is where we really need our civil society groups, our journalists to really continue to push this messaging to ensure that the national policymakers can really start to make this domestic investments. Over to you.
Thank you very much. Would anyone else like to respond to that question?
Yes, I totally agree with the sentiments. And in fact, when governments talk about water, governments will talk about water for, just getting water into the households, and then probably you pay for it, tap water. Governments will talk about water for irrigation and for commercial use, but we've not seen water, and clean water for that matter, as a public good that should be provided in public spaces. And when we were doing the IPC scorecard in one of the communities, and we were interacting with one of the vegetable feeders, she asked us a simple question. Is it right that I should buy water and use that water to clean the vegetables for my customers, and I still buy water and use that water to wash their hands? And she said, no, I'm not going to do that. I'll clean the vegetables for you, but you go and clean the hands for yourself. But we also discovered that, as one of the participants has said, when you look at the vegetable dealers by the roadside, you discover that the same water they use to wash, the same basket they are cleaning the vegetables in, they dip the vegetables and they move them out, is the same one that they use to clean their own hands. And if a customer wants to clean her, he or she will also use the same. So what we are, as an organization, what we have done when we present the scorecard to county governments or the districts, we are also persuading government to make water for hand hygiene in public spaces a public good that is provided for and planned for alongside other investments. Unless that is done, the number of small-scale traders, informal sellers on the streets is huge, and that number we cannot just ignore them, and we have to make sure that the service they are providing, they are earning decent livelihood, but they are doing it in a safe space. Thank you.
Thank you very much. As you know, this media dialogue is attended by many journalists in the ESA region, and I would like to ask this question of our group of speakers, and it's a question from Sarah Mawere, who is a media producer in Uganda. She asked, how best can media make real stories out of hand hygiene that are beneficial and important? Which are the best angles? Now, I know this is a question we often have answered by our own media experts, but perhaps I can ask that question of the group. Basically, the question is, how can the media help get the message about the importance of hand hygiene out to the public? That question's for anybody on our panel.
Yeah, I can try.
Sorry.
Go. Okay, Pierre first.
Yeah.
Yeah, I think one entry point for the media is really the stories that can be told by children. And in most school, in every school, or in most schools in sub-Saharan Africa, there are what we call the school hygiene clubs, or the hygiene promotion clubs or associations in the schools, and these are the champions for hand hygiene. And generally, they are very active to first of all to advocate for low-tech, low-cost hand hygiene solutions in the schools with their head teachers, trying as well to fundraise with the parents, the teacher parent associations, but also to promote hand washing among the teachers and their other pupils. So really take this opportunity of discussing and getting these stories from children. And I'm sure you'll find very nice stories to tell. Over.
Thank you very much. Anyone else with some advice for the media?
Yeah, I think one of the things that I would appreciate if media can be able to do is that when we have an outbreak, whether it's cholera or any other hand hygiene related sickness, other than focus only on the numbers, it would be good to ask the governments and in the stories to give the background of the people in terms of how are they living, where are they coming from, what is their hand hygiene practice. So go deeper to the root causes of the outbreak, so that if we marry the two together, we are going to be able to show the need, because the tendency is just to say this number of people have died in this area, but you don't dig below that. So that's one thing. The second thing is also to tell a human story. Tell a story of speak to the people themselves, like the cases I gave. Talk to the owners of food kiosks and ask them what are the challenges they face in meeting those standards, because it's not that they are high-headed. They face that certain challenges. So tell that story from the reality of what they go through.
Okay, thank you. Thank you. Dr. Cabego, would you like to say something?
Yes, I totally agree with all my colleagues. Maybe what I can add, it's important as well to, if you can provide some success stories, highlighting, for example, successful hand hygiene campaigns, initiatives, or innovations that have led to significant improvements in hand hygiene compliance, for example, and IPC. Also, what is important as well, expect interviews like this one, which features interviews with hand hygiene experts, healthcare professionals, or even public health officials who can really provide insight into the importance of hand hygiene. Also, as Dr. Mwangi said, there is an importance to have some human interest stories that share real life stories of individuals, families, or communities who have been affected by the consequences of poor hand hygiene such as healthcare-associated infections, or those who benefited from improved hand hygiene practices. So I think that this kind of stories can help to put a human face on the issue and resonate with audience and on personal level. Important as well to maybe conduct some investigative reports into the state of hand hygiene in healthcare facilities or public spaces. And this can help to shed light on areas that needs improvement, and holding authorities accountable for addressing these issues. The other way that the media can contribute is around educational content, for example, developing some informative content such as infographics, videos, or interactive quizzes that can really educate the audience about hand hygiene best practices. And there is a need to have collaboration, to collaborate with health organizations like WHO, the CDC, and the local public health agencies as well, to share accurate and up-to-date information on hand hygiene guidelines and recommendation. So I think this can really improve the way the media communicates, and it can have a positive outcome on the population.
Very good, thank you.
Can
Unfortunately,
I add just one point for the
yes.
media?
Yes.
One aspect that needs to be said is really the impact of the economical crisis on hygiene items, not only soap, but menstrual hygiene pads, for example. And so what I would advise is really for the media is when they organize interviews, possibly even focus group discussions in poor communities, is to discuss about what are the barriers and the bottlenecks to hygiene, and to hear about the difficulties for the poor families to sustain and to buy hygiene items. So here, really, I encourage you, and this also can help the decision maker, the decision making people, the government, and also the legislative people in the government to discuss about waiving fees or possibly removing the taxes on these hygiene items. That is essential for the dignity and the life saving of people over.
Thank you so much, Pierre. Oh, yes, anyone else? Yes. Okay, please go ahead.
Great. I think really fantastic points from my co-panelists. But most importantly, is really to encourage journalists that we have global days like the World Hand Hygiene Day, which really serves as a selling point. That is where the story starts. That is where the story, we as technical people have highlighted the successes, the best practices, the challenges. That is your story. So the real, that is where it starts. There's always going to be a special day that is being dedicated. Think about children, women, think about healthcare services. That is where your story starts. So we're hoping that tomorrow we will be able to see some stories coming out from your different media houses to really give the spotlight to the Global World Hand Hygiene Day. Thank you.
Excellent. Yes, and of course, we will send a recording of this dialogue out to all of the participants today. So all the journalists will have that, so they can pull quotes from this today's dialogue in their coverage of Hand Hygiene Day tomorrow, May 5th. Unfortunately for today, folks, we have run out of our time, and I just want to let you know that we also will send out audio excerpts of today's dialogue to our full journalist network via WhatsApp. And for all the participants today, we'd love to hear from you about how you use the information you gained in today's dialogue in your reporting. So please feel free to send us your work. And we will endeavor to send you the presentation slides from today that you can also use as a good resource for your journalism reporting. So please, I'd like to thank our wonderful speakers today, Dr. Landry Kebego, Dr. Yewande Alimi, Pierre Furkasi, and Dr. Mwenge Waituro. It was an excellent presentation on the issue of hand hygiene and what the media can do to promote it in their work. But for now, until next time, for the ISAR RCCE Media Working Group, I'm Wayne Sharp saying thanks to all of you for joining us, and please stay safe. Bye-bye.
Bye-bye.
Bye-bye. Thank you.